Thank you, Madam Speaker. I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous material on H.R. 6087, the Improving Access to Workers' Compensation for Injured Federal Workers Act.
Without objection, so ordered.
Thank you. Madam Speaker, I yield myself as much time as I may consume.
Gentleman is recognized for such time as he may consume.
Thank you, Madam Speaker. Today we are considering a straightforward bipartisan bill that will alleviate some of the barriers federal workers face seeking treatment and care after they've been injured on the job. Right now, whether we represent urban districts or rural districts, we're all hearing about the very real shortage of physicians, whether it's in general practice or specialty practices. That's why it's important for Congress to surgically and intelligently reform outdated, antiquated policies in place that prevent qualified providers from treating patients who need their care. This bill achieves that goal for federal employees who need treatment for workplace injuries or illness and will allow qualified, licensed nurse practitioners and physician assistants to treat these patients safely and competently and be reimbursed under the Federal Employees Compensation Act. The bill explicitly states in Section 2 that such treatment must adhere to the scope of practice for nurse practitioners and physician assistants as defined by state law. I repeat, the bill was carefully crafted so that it does not encroach on the authority of state health licensing boards to determine the scope of practice. That is one of the reasons why the Education and Labor Committee came together on a bipartisan basis to unanimously endorse passage of this bill. Right now, injured federal workers who serve our nation at agencies such as the Department of Homeland Security, the Postal Service, and our national parks, to name a few, can only receive the care they're entitled to under the federal workers' compensation law if it's provided by a physician, and only a physician can certify a claim, regardless of whether the state the worker resides in allows nurse practitioners and PAs to practice independently. As any healthcare patient in America knows, nurse practitioners and physician assistants are a growing portion of primary care and healthcare workforce nationwide, especially in rural areas. Patients are ably and safely treated by NPs and PAs in these settings every day, and having the capability to be treated by a nurse practitioner or physician assistant increases access to more timely treatment, particularly in parts of the country experiencing physician shortages. The benefit of increased access was confirmed by the Congressional Budget Office in their analysis of this bill, which found that it would have no impact on direct spending by the government. Given the challenges some federal workers have in accessing their federal workers' comp benefits, allowing these providers to be reimbursed for the care they provide within the scope of their practice is an extremely common sense improvement. CBO has even stated that this legislation would help injured federal workers return to the job faster. In this labor market, anything we can do to improve workers' healthy recovery and job retention is worthwhile. This bill has been endorsed by the National Rural Health Association, the American Nursing Association, the American Association of Nurse Practitioners, the American Academy of Physician Assistants, as well as a diverse coalition of unions representing federal employees such as the National Treasury Employee Union and the National Postal Mail Handlers Union. Further, the Department of Labor's Office of Workers' Compensation Programs, which administers the Federal Employee Compensation Act for federal workers, as diverse as in agencies such as the Pentagon, the Department of Homeland Security, Interior, and Veterans Affairs, has confirmed that this legislation would help alleviate barriers that create delays for such claimants and would expand injured workers' access to medical treatment. Madam Speaker, I have the honor to represent the largest military installation in New England, Submarine Base New London, which employs over 1,000 civilian federal workers who perform outstanding work to support the 16 attack submarines that deploy from that base. Some of that work is physically demanding, such as firefighters, police, and crane operators, and injuries do happen. This bill will create healthcare parity for those patriots by ensuring that they will have their claims handled and treated the same as any other workers who reside in Connecticut and Rhode Island. This is an overdue and important but common sense way to bring this program in line with the reality of the 21st century healthcare delivery. I want to thank my Republican counterpart, Mr. Wahlberg, for his great support and work to bring this issue forward. And I also want to thank Chairman Scott and Ranking Member Fox for their bipartisan work supporting this bill and getting it through committee. I strongly urge a yes vote on this bipartisan and common sense measure, and I reserve the balance of my time.